Hi, today we're going to be teaching you about ambulations with tethers. Tethers are any line or cable attached to a patient that may increase the risk of falling while ambulating. So some of our tethers that we have our nasal cannula that delivers oxygen to the patient. It can be attached either to the wall or to an oxygen tank. We have our Foley catheter, which should always be attached to the bed frame and kept below the waist. We have our sequential compression devices, which are attached right down here. But if you're ambulating, those can be easily removed so you have one less tether. Over here we have our IV that's also attached to the infusion pump. It delivers nutrients and fluids to our patient, and when ambulating you can saline lock that, so that is also one less tether that you have. Two other things you can use when ambulating to help decrease risk of fall are these non-skid socks that we have and the gait belt, which is put around the patient's waist so that they can be easily held while ambulating. If we go over to our patient, she already has her IV saline locked. Perfect. And she is wearing her non-skid socks. We will want to take the Foley catheter and remove it from the bed frame. Keep it below waist level, so we're going to attach it to the bottom of the walker. And if you have more than 2 tethers, you want to have assistance, but since we just have the oxygen and the Foley catheter, we're good. Before you get started, you want to make sure that your pathway is clear, so remove any objects that may be in the way, and then you'll be good to go. So an important thing to remember is that with your dominant hand, as Nurse Brian is showing, you're going to hold the back of the patient and help guide them, and with your non-dominant hand, you're going to hold the oxygen tank so the patient doesn't trip and fall over it. Then they're ready to go. Going to help her up, and they're going to walk. Some other things you can do is have a wheelchair, someone have you assist with a wheelchair behind you so that in case the patient gets tired or woozy, they can sit down. And remember to ask the patient if they're getting tired while walking. Okay, thanks for watching our video.